Welcome to this episode of the Three Pillars Academy. We're going to talk about self-care in the time of COVID-19. Really excited to be joined by Dr. Vincent Caringi, team psychiatrist for the Cleveland Browns, assistant professor of psychiatry at University Hospitals Cleveland Medical Center. Thank you for joining us.
Absolutely. So as you mentioned, my name is Vince Caringi. I'm an MD at the University Hospitals in Cleveland. I'm not sure if it'll show, but right here is my Twitter handle. So if it shows up on the screen, you guys can follow me because I love to have kind of conversations and discourse with people, like-minded individuals interested in the same sort of things. I'm originally from Cleveland and went to college at Loyola University in Chicago, and then went to medical school in the University of Cincinnati, and always kind of knew that I wanted to come home to work with my community, work in Cleveland, and was pretty quickly drawn to the concept of mental health before I really knew what it was, and ultimately working with young people. And honestly, I kind of made this sort of decision of like I wanted to be someone that could advocate for young people, but also maybe lend some guiding advice. And I know when I was a kid, I listened to my doctor, and that seemed like an important person to listen to that had good knowledge and well studied. And so I said, well, maybe if I do that, young people might actually take my advice and listen, and I can guide them and support them. So that's kind of the direction that led me to medical school. And then interestingly, when I started to do mental health, what I sort of found was I used my position of studying sort of a medical background of psychiatry to then also talk to people of the limitations of what medicine do and what the power that the human potential has in terms of behavior change and the things that we are in control of, that we can make big changes in our life. So they kind of trusted me when I was able to tell them that I don't think medicine is going to be that helpful right now. So it's kind of interesting that you might go to medical school thinking that way you can prescribe medicine. In a lot of ways, I went to medical school, especially for psychiatry and mental health, to advise people when maybe medicine wasn't something that they needed to do. And I played sports my whole life, and an opportunity came around to start working with some professional athletes. And I'm currently still with the Cleveland Browns as their lead behavioral health clinician and team psychiatrist, which is going into my 6th season. And from that, I've kind of worked with some college students and high school students just because the community is not that large here in terms of sports psychiatry. And so I get to work with a lot of different people at different levels of their athletic training, and it's been pretty fun, actually.
That's great to hear. I've heard you talk about holistic health. Can you share these elements of wellness and how they all work together with one another?
Yeah. So again, this kind of goes back to that intro that I was saying. What I found myself doing never in a really consistent way was trying to explain to families, kids, teenagers, parents, why I didn't think medicine. They were coming to see a psychiatrist assuming they were going to leave with medicine. And sometimes the conversation was, I don't think medicine's what we need here. And eventually I kind of streamlined that conversation down. And I used to, there's this old concept of an elevator pitch, which is like 30 seconds. I can't get it done in 30 seconds. So I actually kind of call it my Uber pitch, because like an Uber ride's like a few minutes. So I sort of draw this out usually, and I kind of draw a pie or a pizza, depends on what you're in the mood for. And I make 6 slices of it. And I ask people to kind of be engaged in this conversation when I have it with them, and ask them, what do you think a well human being involves? What does wellness involve to you? Most of the time, they'll hit most of those pie pieces. They'll usually talk about physical, so exercise. They'll usually talk about nutritional, so they'll talk about their diet. Most of the time, they'll talk about sleep, knowing that they need to be sleeping better, sleeping more, whatever. Sometimes they'll talk about mental health. Obviously, that's why they're in my office. That gives me the opportunity to sort of reflect on the fact that I'm a very small sliver of that mental health pie piece. In terms of working with a therapist or a counselor, that probably takes up a much larger chunk of that pie, where psychiatry is a very small sliver. The two that they don't usually think about, which I think are hugely important, I have a pie piece that I talk about as connection, so relationships. We're human creatures, and every civilization known to man thrives on human connection. And then the last piece is reflection. And I named it reflection because it rhymes with connection, but also because it includes things like mindfulness, meditation, yoga, prayer. So there could be a religious aspect if that's something that you're more kind of inclined to do or more comfortable with. And so I get to talk to them about like before we look at my little sliver of the mental health, specifically medication, are you actually doing every other pie piece as well as you can? Or could you exercise more routinely? Could you sleep better? Could you be talking to somebody? Could you be connecting with more people? Could you be reflecting better? So that gives us a chance to say, well, let me try these other things, and maybe then I can be a little bit more comfortable with medicine is for me.
I like that approach and that method that you kind of go about it. It helps think about it more manageably of the different areas of your life, because sometimes you just get overwhelmed and don't know where to start. And I think that last piece where you really talked about meditation and breathing, I've been told and I've tried to be more intentional to do that weekly, daily, but sometimes I hear from others it's hard to do, like know what to do or how to start it. So can you discuss some tips, benefits, takeaways for individuals on meditation, breathing, that self-care?
Yeah. So this is a conversation like I could have endlessly with people, because I think it's kind of fun and fascinating, and different people bring their personal experience and what their wishes and goals from some a practice like that is for them. I think it breaks down to a lot of basic things initially. We as humans have a tendency to control or want to control. And when we can't do that, that leads to a lot of worry and a lot of anxiety. And so what I think we're recognizing now, especially in this kind of pandemic situation with COVID-19, is that with so much uncertainty, that's a huge trigger for that worry and that anxiety, because we aren't able to control. There's so much uncertainty. And so we get caught up into the what might happen, what could go wrong. And that fear, first of all, our mind is in a future moment that we can't control, and that fear is really uncomfortable. And so that becomes really, really stressful and taxing. And I think people experience it all the time. That's a human condition. But what I think is really magical about a meditation or a mindfulness, specifically a mindfulness meditation practice, is it's not that hard if you can break it down. And if you can, what I like to say is demystify it, because I think people have an idea sometimes of what it is. And I spend a lot of time talking to people about what it isn't. And that seems to kind of make them feel a little bit more comfortable. It's really easy as humans to be perfectionists and to get caught up in, doing it right mode. But the foundation of what I talk to people about starting a practice is there's 3 elements: paying attention to the present moment. You're doing that on purpose. You're actually paying attention to what's happening now without judgment. That last part's really hard, admittedly. Because when you're starting to pay attention to what you're feeling and what you're thinking in the moment, it's really hard not to have some judgment. But that's kind of like a long-term goal. And I always kind of break it down to people to tell them that starting small is okay, because even 1 minute counts. There's actually physical and biological evidence that even a minute a day can make a difference. And again, to kind of break down that perfectionist mentality that we sometimes have, my goal for people is do it daily-ish. Like, you're probably not going to do it every day. And you got to be kind to yourself. You can't beat yourself up that you missed a day. So if your goal is daily-ish, you give yourself a little bit of wiggle room. I've been doing it without even really knowing I was doing it initially for years by accident. I kind of got into it because I ended up doing a college research paper on a separate religion, and I happened to be assigned Buddhism, and they have a lot of this mindfulness meditation practice in the religion. And so I kind of got exposed to it, not by choice. And then I realized I was turning to the skills without knowing it. And then I started, as you kind of mentioned, started to think about how do I do this intentionally, and started small. So that's kind of a tip that I tell people. The second tip is starters should take advantage of technology. I still use guided meditation apps. I think that there's 5 or 6 that do a fantastic job. And if you just go in your app store and basically put in mindfulness or even meditation, you'll see the most downloaded ones. Some of these are more popular. I think you're seeing probably LeBron commercials is now on, he's promoting Calm. Kevin Love here in Cleveland's been huge in the mental health space and talking about things, and he's supporting Headspace. There's a really amazing guy named Dan Harris that talks about it, and he has an app called 10% Happier. And I use it all the time. I use a guided meditation because sometimes it is hard just to sit down stick with that small goal that you have for the day.
Right. There's so many resources, and it's just a matter of finding what fits and works for you.
Here's one tip. If I can give you one tip about someone who's looking to get started, here's my tip that I use to teenagers and young adults and even athletes when I work with them. Take advantage of something you're already doing. So follow me on this example for a second. How often do you take a shower? I take a shower every morning. It's my morning routine, right? So I already have that disciplined routine where it's in my, that's part of my day. So great. A lot of people have that routine. They take a shower every day. But then I ask people and they kind of look at me like kind of sideways when I ask them. I say, but when you're in the shower, are you actually in the shower? Because think about all the planning you're doing. You're planning, you're texting, you're fantasizing. Your head is everywhere but that shower. So if you already have something you're already doing every day built into your daily routine, for 1 minute of your shower, just take a shower. Because you wouldn't believe how powerful being mindful of the fact that you're in the shower and you have all these things that can keep you present in that moment. You can feel the temperature of the water. You can kind of feel the soap and that texture. You can smell sort of some of the aromas if you're using certain kind of shampoos, whatever. But all those things keep you present in that moment. And I find that people realize that they spend a lot of time pre-planning, worrying, fantasizing in the shower. And it's almost like this, you're in this kind of auto mode without even realizing that's a great opportunity to build a daily habit and something you're already doing.
Well, that's a great example. And I'm sure many others have daily habits like making their coffee or open up the newspaper, just intentionally finding a creative way for even just 1 minute of being present in that moment. Off of that, we are in such a time of unknowns and challenges. What advice do you have for student athletes, coaches, administrators, staff members on being intentional with their self-care and holistic health?
Yep. I think the one conversation, actually, I was having this conversation earlier today, and so this is why it's at the top of my head, is I was having this conversation about the debate between discipline and motivation. And you can kind of use that in this example and in sort of any example of behavior change. Self-care can, for a lot of people, be a very different change in their routine and what they're used to doing. And a lot of people wait for that motivation to come on a daily basis for them to actually go ahead and take care of that self. The problem is if you actually look at the English language, motivation is a noun. So motivation is going to come and go. So it's great to take advantage of motivation in that moment for your end goal. Like what is the goal you want to create, or the new behavior or the new skill? But out of those two words, discipline is actually the verb. So discipline is something that you choose to do. So if you're aware of the fact that, gosh, something motivated me, something inspired me, take advantage of it and use it then to start to create the discipline you'll need. Because when it's gone, it's the discipline that's going to carry you through to continue those kind of things.
And lastly, May is Mental Health Month, and one thing at our conference and our institutions continue to push and prioritize mental health for all. I'm interested, Vincent, in what are some themes and discussions in your industry around prioritizing and taking action to help individuals with their mental health?
I think this question probably reflects better, if I go back to that conversation about the pie, is the connection piece. It's really about relationship building. What I find is that the most significant progress and benefit that humans have is when they can resonate with another person. And we have all these kind of different examples about how to kind of describe this, right? If I have a burden and I'm carrying this burden by myself, if I share that burden with somebody and they can help carry that burden with me, now all of a sudden the weight is lifted a little bit for me, and I don't have to carry it all alone. So for this month and every month, just because I'm in the field, what I really encourage people to do is in that connection pie is to build relationships, tell your story, because that story might resonate with someone and allow them to connect with you in a deeper way. And that's really how we become whole and how we become healthier as humans. So if you have a story to tell on any platform, on any format, I'm encouraging people to tell their story.
Well, thank you for this conversation. I think your approach with holistic health is very important and an easy way for everyone to kind of break down and look at all parts of their life for that holistic health.
I
Thank
appreciate
you.
it.
Yes, thank you again for joining this Three Pillars Academy episode.
Absolutely. Thank you for having me. Follow me here because I'll follow back. I'll get your likes up. We'll have conversations. We'll build these relationships. We'll resonate with each other. And I'm happy to join you. And hopefully there'll be times in the future we can chat again.
Wonderful. Thanks.
All right.